25 years of innovating and transforming treatment in hormone-positive human epidermal growth factor receptor 2 HR plus HER2 advanced breast cancer. Innovations in the treatment of hormone-positive HR plus metastatic breast cancer, expanding the evidence base with PI3K inhibitors. In her presentation, Professor Hope Rugo, the Director of Breast Oncology and Clinical Trials Education at the University of California, San Francisco, further emphasized the efficacy of alpelisib in the treatment of hormone-positive HR plus metastatic breast cancer, as shown in large clinical trials. PIK3CA is one of the most frequently mutated genes in hormone-positive human epidermal growth factor receptor 2 HR plus HER2 advanced breast cancers, leading to the hyperactivation of the PI3K pathway associated with endocrine resistance. Thus, a PIK3CA gene is a negative prognostic factor in this patient's population. Preliminary data have shown that the combination of alpelisib with fulvestrant markedly improves survival outcomes in pretreated patients with a PIK3CA mutation. A Phase 3 randomized double-blind placebo-controlled trial SOLAR1 was conducted in patients with HR plus HER2 advanced breast cancer who had received endocrine therapy ET. Overall, 572 patients were randomized to receive either alpelisib 300 mg daily plus fulvestrant 500 mg every 28 days, and once on day 15 or placebo plus fulvestrant. Results show that alpelisib fulvestrant significantly prolonged the progression-free survival among patients with PIK3CA mutations and 341, compared with the placebo fulvestrant arm. In terms of adverse events, ACE patients commonly experienced hyperglycemia, rash and diarrhea, with only 25% discontinuing alpelisib due to toxicity. Researchers noted that effective prophylactic and management strategies along with a proper provider and patient education may reduce the incidence of ACE. For instance, they recommended that all patients should receive prophylactic antihistamines and regularly check their hemoglobin A1C, HbA1c, and fasting glucose levels. In patients who required lower doses of alpelisib for AES management, progression-free survival benefit was maintained. Another Phase 2 open-label, non-comparative trial by Leaf studied the combination of alpelisib with endocrine therapy, ET fulvestrant or letrozole, in patients with PIK-mutated, HR plus HER2 advanced breast cancer, who did not initially respond to cyclin-dependent kinase inhibitor, CDK inhibitor, endocrine therapy ET. The survival rate reached 60.4% at 6 months, further supporting the use of alpelisib fulvestrant and suggesting a benefit with letrozole even in patients resistant to aromatase inhibitors.